My name is Dr. Wilfred Lumbang, and I am a Mohs surgeon.
My name is James Allred, and I am a dermatologist.
A lot of people neglect their skin, and since I have moved here in Kentucky, I've actually done quite a bit of complicated skin cancer surgery because a whole lot of patients here or individuals would neglect their skin cancers.
Within Bowling Green and Southern Kentucky in general, we see a lot of people who are outside, whether it's for work, they're farming, they have been to the beach their entire life or the lake. So I see sort of two distributions now. I definitely see people later on in life, but I'm also increasingly seeing younger patients who have had a lot of exposure in tanning beds. I have patients in their early 20s who've had melanomas, and so for skin cancers, it's prudent to have monitoring at home and to be aware and have skin checks really at any stage of life, because unfortunately it's such a prevalent disease, and we're seeing it in a lot of people that you don't necessarily expect it to be seen.
So my practice is heavily focused on skin cancer. Having been a Mohs surgeon since 2010, I now see basically just surgery patients. So my colleagues here at Graves Gilbert would typically biopsy skin cancers, and they would refer some patients to me, those that fit the criteria for Mohs surgery. It's a difficult thing to remember, but Mohs surgery is spelled M-O-H-S. It's named after the doctor that actually started the procedure. Now it's actually the treatment of choice for skin cancers on very difficult to treat areas, specifically on the head and neck. Well, Mohs surgery is an interesting technique in that one doctor can actually perform the removal of the skin cancer, and then that same doctor will actually look at the tissue under the microscope, so they also serve as the pathologist. And once all of the skin cancer is removed, the same doctor will actually reconstruct the wound. So one person does three jobs. It's a highly efficient procedure, and it's also a great technique to use for very difficult to treat skin cancers because the cure rate can go up to 99%.
Dr. Lumbang, our Mohs surgeon, he serves as the surgical oncologist, so the physician who removes the tumor. In many ways, he uses techniques of a plastic surgeon so that he can close the wound in a way that has the best cosmetic result possible. That I think that a superior closure to pretty much almost anybody that I've ever seen, including plastic surgeons. He also serves as the pathologist. So when he removes the lesion, he actually analyzes it there while you're leaving. And so in one physician and in one visit, you actually have essentially multiple skill sets brought to bear. And so that results in the highest treatment success for skin cancers and the lowest cost.
We have this mentality that people have to come to a big city to get great care. I wanted to move to a smaller community to offer that great care. I think with my extensive training, both in surgery and pathology and reconstructive surgery, I put my heart into every single patient that I take care of, that they're not going to get anything less by staying here at Bowling Green and getting taken care of by somebody who's here in Bowling Green. I really personalize my care with every single patient, and I offer them every single option possible.